Look at your nails right now, not later, not after this video, right now, because what you're seeing on them could be your body trying to warn you. And 99% of seniors ignore it. I'm not exaggerating. As an ER surgeon, I've had patients walk in with serious conditions already advanced. And when I look back, the signs were there the whole time. They're not in pain, not in symptoms they could feel. On their nails, lines, color changes, thickening, splitting. They saw it. They ignored it. Here's the truth. Your nails are not just cosmetic. They reflect what's happening inside your body: blood flow, oxygen levels, liver function, even heart stress. And after 60, these signals become louder, but people stop paying attention. And this is where it gets dangerous, because most of these changes don't hurt. They don't stop you from moving. So if you brush them off, just aging, just dryness, until something bigger shows up. By then, it's already progressed. I've seen people come in with issues that could have been caught early, just by looking at their nails and taking it seriously. In this video, we will reveal 7 nail signs that could point to serious underlying problems you should never ignore, ranked from the least to the most dangerous. And the number 2 sign is something many seniors have right now, but don't realize what it actually means. References are in the description if you want to check. Before we dive in, here's a quick question. Where are you watching from? I read and reply to every single comment, so tell me honestly. Now, let's begin with sign number 7. And if you have this, your body is already trying to tell you something. Number 7. Pale or white nail beds. If you look at your nails right now and the pink color that's usually there has faded into a pale, washed out white, that's not just a cosmetic issue you can ignore. That's your body telling you something is seriously wrong with your blood. Healthy nails get their pinkish color from the tiny blood vessels running underneath the nail plate. When those vessels aren't carrying enough healthy red blood cells, or when the blood itself is running low in hemoglobin, the nail bed loses that warm pink tone and turns pale or even completely white. This is one of the earliest visible signs of anemia, a condition that affects over 1.6 billion people worldwide, according to the World Health Organization. Now, anemia sounds harmless to a lot of people. They hear the word and think it just means being a little tired. But in seniors, anemia can be genuinely dangerous and even deadly. A study published in the American Journal of Medicine found that seniors with untreated anemia had a 41% higher risk of death over a 5-year period compared to those with normal blood levels. That's not a small number at all. The reason anemia becomes so dangerous in older adults is that it forces your heart to work much harder to pump oxygen throughout the body. Your heart is already working hard as it is, and now you're asking it to compensate for blood that isn't doing its job properly. Over time, this extra strain leads to heart enlargement and eventually heart failure, especially if the heart is already weakened by age or other conditions. The most common causes of anemia in seniors are iron deficiency, vitamin B12 deficiency, and chronic kidney disease. Each of these has a very different treatment approach, and the only way to know which one you're dealing with is through a simple blood test called a complete blood count. If your doctor finds low iron, increasing your intake of red meat, spinach, lentils, and fortified cereals can help, but in many cases you'll need a dedicated iron supplement to bring levels up fast enough. For B12 deficiency, which is extremely common in people over 60 because the stomach produces less of the acid needed to absorb B12 from food, sublingual tablets that dissolve under the tongue or direct B12 injections work best. The key thing is to not ignore pale nails and assume it's nothing. Check them in natural daylight, press gently on the nail tip and release, and watch how quickly the pink color returns. If it takes more than 2 seconds to come back or barely returns at all, bring it up with your doctor at your very next visit. Now, here's a sign that most people have never even heard of before. Number 6, spoon-shaped nails. This one sounds strange when you first hear it, but it's extremely telling about what's going on inside your body. Spoon-shaped nails, which doctors call koilonychia, happen when your nails curve upward at the edges and dip down in the center, creating a shape that could literally hold a small drop of water. If you put a single drop of water on a normal, healthy nail, it would slide right off immediately. But with spoon nails, the drop just sits there like it's resting in a tiny bowl. This condition is strongly linked to iron deficiency anemia, but it also signals liver disease and thyroid problems in older adults. A clinical review published in the Journal of the American Academy of Dermatology reported that koilonychia was present in up to 32% of patients with confirmed hemochromatosis, which is a condition where your body absorbs way too much iron from the food you eat and deposits it directly into your organs, especially the liver, heart, and pancreas. That excess iron slowly destroys those organs from the inside without giving you obvious symptoms for years. The reason this is particularly dangerous for seniors is that hemochromatosis often goes completely undiagnosed for decades because its symptoms, things like fatigue, joint pain, and general weakness, are so easily blamed on normal aging. People just assume they're getting old. By the time most people finally get diagnosed, significant organ damage has already occurred, and some of it is irreversible. A study from the Annals of Internal Medicine showed that early detection of hemochromatosis reduced liver-related deaths by up to 60%. That's a massive life-saving difference, and the whole chain of discovery can start with just noticing the unusual shape of your nails. If you see the spoon shape forming, even mildly, you should request a serum ferritin test and a transferrin saturation test from your doctor. These are simple and inexpensive blood tests that can reveal whether your iron levels are dangerously high or dangerously low. Treatment depends entirely on the root cause. For iron overload, therapeutic phlebotomy, which is basically regular blood draws to remove excess iron, is the gold standard treatment. For iron deficiency causing the spooning, proper supplementation and targeted dietary changes work well. Either way, the nail is doing you a huge favor by showing you what blood tests haven't been ordered to find yet. Pay attention to the message. This next sign shows up as something you might just think is an old bruise. Before we continue, take a second to like this video and subscribe. There's even bigger insight right after this. Number 5, dark streaks or lines under the nail. If you notice a dark brown or black streak running vertically from the base of your nail all the way to the tip, please do not ignore it. Many people assume they just bumped their finger at some point or that it's simply a normal part of getting older, but a dark longitudinal streak on the nail can be a sign of subungual melanoma, which is a dangerous type of skin cancer that grows underneath the nail. This is one of the most frequently missed cancers in all of medicine, especially in older adults and people with darker skin tones. A study published in the Journal of Clinical Oncology found that subungual melanoma accounted for up to 75% of all melanomas in African American patients and was consistently diagnosed at a much later stage in seniors compared to younger adults. The reason it gets missed so often is that people simply don't think of skin cancer as something that can happen under the nails. It doesn't fit their picture of what cancer looks like, but it absolutely does happen there. The cancer starts in the melanocytes, which are the pigment-producing cells that sit in the nail matrix, the tissue under the base of your nail where new nail growth begins. As the melanoma grows, it produces a dark streak of pigment that moves outward with the nail as it grows. One of the critical warning signs that doctors specifically look for is called the Hutchinson sign, which is when the dark pigment extends beyond the nail itself onto the surrounding skin of the cuticle or fingertip. A retrospective analysis published in the Archives of Dermatology found that the presence of the Hutchinson sign was associated with confirmed melanoma in over 77% of cases studied. Early detection is absolutely critical with this type of cancer because the 5-year survival rate for early-stage subungual melanoma is around 80%, but once the cancer spreads to lymph nodes or distant organs, that survival number plummets to under 30%. If you see a new dark streak appearing on any nail, especially if it's only on a single finger, if it's wider than 3 millimeters, or if it appears to be getting wider over time, see a dermatologist immediately and don't delay. They'll perform a nail biopsy to determine whether the cells are cancerous or benign. Don't let anyone tell you it's just a bruise without properly examining it first. This is one of those situations where being overly cautious can literally save your life, and you won't regret pushing for answers. Now let's talk about a sign that happens right at the very tips of your fingers. Number 4, clubbed fingertips and nails. Clubbing is one of the most dramatic nail changes you can ever see on a person, and it's also one of the most medically serious. It happens when the tips of your fingers begin to swell and become rounded, and the nails start to curve downward over those swollen tips, almost like they're trying to wrap around a small ball. The angle between the nail base and the cuticle, which is normally less than 160 degrees in a healthy person, increases to over 180 degrees in someone with clubbing. You can actually test for this yourself at home using a simple method called the Shamroth window test. Place both of your index fingernails together back to back with the nails touching. In a healthy person, you'll clearly see a small diamond-shaped gap of light between the nail beds where they meet. If that diamond of light disappears completely and the nails just press flat against each other with no gap at all, that's a positive sign of clubbing and you should take it seriously. This nail change is linked to serious lung and heart conditions that can be life-threatening. A study published in the journal Thorax found that clubbing was present in approximately 29% of lung cancer patients at the time of their initial diagnosis. Another important study in the European Respiratory Journal reported that digital clubbing appeared an average of 7 months before lung cancer was formally detected through medical imaging like CT scans. That's 7 full months of advance warning that your body was giving through your fingernails alone, and most people just didn't know to look for it. Clubbing develops because of chronically low oxygen levels in the blood over an extended period. When your lungs or heart can't deliver enough oxygen to your tissues, certain growth factors called vascular endothelial growth factor begin to accumulate in the fingertips and cause the soft tissue there to expand and swell. Beyond lung cancer, clubbing is associated with pulmonary fibrosis, congestive heart failure, inflammatory bowel disease, and liver cirrhosis. If you notice your fingertips looking puffy or unusually bulbous, or if your nails seem to be curving downward more than they used to, get a chest x-ray and pulse oximetry reading done as soon as you possibly can. Early identification of the underlying cause behind the clubbing makes a dramatic and meaningful difference in treatment outcomes and survival rates. This next one is something almost every senior notices but very rarely questions. Number 3, thick, yellow, crumbling nails. Most people see thick yellow nails and immediately jump to the conclusion that it's just a fungal infection and nothing to really worry about. And honestly, in many cases, that assumption is correct. But here's what most people don't realize and what their doctors often don't explain. Persistent, treatment-resistant thick yellow nails can also be a warning sign of diabetes, lymphatic disease, and chronic respiratory conditions hiding beneath the surface. A condition called yellow nail syndrome is an actual recognized medical diagnosis where all 20 nails turn yellow, grow extremely slowly, and become significantly thickened and curved. This syndrome is strongly associated with pleural effusion, which is a dangerous buildup of fluid around the lungs that makes breathing difficult, and lymphedema, which is serious swelling caused by a compromised lymphatic drainage system. A study published in the journal Medicine found that over 40% of patients diagnosed with yellow nail syndrome also had underlying lymphatic or respiratory disease that hadn't been identified or treated yet. The nails caught what routine checkups completely missed. Now, even when the cause really is just a fungal infection, ignoring it in seniors is still a genuinely bad idea with real consequences. A fungal nail infection called onychomycosis affects roughly 20% of adults over 60 and nearly 50% of those over 70, according to research published in the Journal of the European Academy of Dermatology and Venereology. In seniors who also have diabetes, even a simple fungal nail infection can become a dangerous gateway for bacterial infections that spread to the surrounding skin and deeper tissues. A diabetic foot study published in the journal Diabetes Care showed that nail fungal infections increase the risk of secondary bacterial cellulitis by over 3 times in older diabetic patients. Cellulitis can become genuinely life-threatening if the bacteria enter the bloodstream and cause sepsis. If your nails are thick, yellow, and crumbling at the edges, get them properly evaluated by a professional and don't just buy an over-the-counter cream. A simple nail clipping can be sent to a laboratory for a fungal culture to confirm exactly what you're dealing with. If it comes back positive for fungus, oral antifungal medications like terbinafine taken for several weeks are far more effective than any topical treatment, particularly for toenails where the infection tends to be deeper. But if the test comes back negative for fungus and the yellowing and thickening persist, push your doctor for further investigation into your respiratory health and lymphatic function. What comes next might genuinely surprise you because it's something hiding in plain sight. Number 2, horizontal dents across the nail. These are called Bowes lines, and they're one of the most underappreciated and overlooked warning signs in all of medicine. These lines are deep horizontal grooves or indentations that run across the nail from one side to the other. They're absolutely not the same as the vertical ridges that many people develop naturally with age, which are usually completely harmless. These lines run horizontally, and they form when nail growth is temporarily interrupted or completely halted by a severe stress event happening somewhere in the body. Think of them like tree rings that record seasons of hardship. Each groove represents a specific moment when your body went through something serious enough to pause nail production entirely because your body decided to redirect its energy and resources elsewhere. A clinical study published in the British Journal of Dermatology found that Bowes lines were clearly present in over 54% of patients who had been hospitalized for severe illness within the previous 3 months. The causes behind these lines include uncontrolled diabetes, severe zinc deficiency, major infections like pneumonia, chronic kidney disease, and even heart attacks that the patient may not have fully recognized at the time. One of the most significant recent findings came during extensive research on severe viral infections, where studies published in the Journal of the American Academy of Dermatology documented Bowes lines appearing in over 68% of patients who experienced severe systemic infections. These lines showed up on their nails roughly 2 to 3 months after the illness occurred. That time delay is the key to understanding this sign because nails grow slowly at a rate of about 3 to 4 millimeters per month for fingernails and even slower for toenails. So the groove you see on your nail today actually reflects something that happened to your body weeks or even months ago. It's like reading a delayed message from your own biology. If you notice a deep horizontal line appearing on multiple nails at roughly the same position relative to the cuticle, that strongly suggests a systemic event that affected your whole body rather than just local trauma to one finger. One line on one single nail could easily be from bumping it on a door or a counter. But matching lines across several or all of your nails at the same level is your body's own medical record written in keratin protein. Bring this finding to your doctor's attention and work backward on the timeline together to identify what happened during that window. This detective work can uncover missed cardiac events, undiagnosed infections, blood sugar crises, and metabolic emergencies that still need follow-up treatment and monitoring to prevent them from happening again. Now, here it is. The number one sign on this list, the one you absolutely cannot afford to miss. Number 1, small dark splinters under the nail. These tiny dark lines that look like little splinters trapped under your nail are called splinter hemorrhages, and they're the single most dangerous nail sign on this entire list. They're thin, reddish-brown or dark lines that run vertically under the nail plate, and they look so innocent and minor that almost everyone who sees them assumes they just got a small injury to their finger that they don't remember. Maybe they closed a drawer too hard or bumped something without noticing. But when splinter hemorrhages appear on multiple nails at the same time without any clear history of trauma or injury, they can be a direct and urgent warning sign of endocarditis, which is a life-threatening infection of the inner lining of your heart and its valves. A landmark study published in the British Journal of Dermatology found that splinter hemorrhages were present in up to 92% of patients with confirmed infective endocarditis. 92%. That is an almost perfect correlation between a simple, easy-to-spot nail finding and one of the deadliest heart conditions that exists. Endocarditis happens when bacteria enter the bloodstream through various routes, such as dental procedures, skin infections, or even routine activities, and then attach themselves to damaged or weakened areas of the heart valves. In seniors, this is especially dangerous because age-related valve degeneration and calcification create far more rough spots and surfaces where bacteria can settle down and multiply. The bacteria form growing clumps called vegetations on the valve surface, and tiny fragments of these vegetations regularly break off and travel through the bloodstream to distant parts of the body. When these microscopic infected fragments lodge in the tiny capillaries that run under your fingernails, they cause those thin dark lines that look exactly like splinters embedded in the nail. A major study published in the American Journal of Cardiology found that the mortality rate from infective endocarditis in patients over 65 was approximately 30%, even with aggressive hospital treatment, including intravenous antibiotics. Without any treatment at all, endocarditis is almost universally fatal. The frightening reality that makes this so insidious is that endocarditis symptoms in seniors are often incredibly vague and nonspecific. Low-grade fevers that come and go, general fatigue, unexplained weight loss, night sweats, and mild body aches are all easily mistaken for the flu, a common cold, or just the general effects of getting older. Many seniors live with these symptoms for weeks before anyone thinks to investigate the heart. The splinter hemorrhages appearing under the nails are sometimes the most visible, the most specific, and the most important clue available before the diagnosis becomes obvious through other means. If you see multiple thin, dark, reddish-brown lines under your nails that you genuinely cannot explain with a recent injury or trauma, request blood cultures and an echocardiogram from your doctor right away without delay. Blood cultures can detect the specific bacteria responsible for the infection, and an echocardiogram uses ultrasound to directly visualize the vegetations growing on your heart valves. Early and aggressive treatment with targeted intravenous antibiotics dramatically improves survival rates and can prevent the catastrophic complications of valve destruction, stroke, and organ damage. So there you have it. 7 nail signs that your body uses every single day to warn you about serious and potentially deadly conditions happening inside you. From pale nail beds quietly signaling anemia all the way to those tiny splinter-like lines urgently warning you about a lethal heart infection, your nails are constantly communicating with you. They're sending you messages you were never taught to read. The real question now is whether you're going to start paying attention. Take a moment today, right now even, to really look at your nails under good natural light. Check their color carefully, examine their shape, feel their texture, and look for any lines or marks you haven't noticed before. If anything on this list matches what you see on your own hands, please don't wait and don't brush it off. Talk to your doctor and tell them exactly what you noticed. Early detection is the difference between a simple treatment and a life-threatening emergency. If this video helped you today or taught you something new that you didn't know before, please hit that subscribe button so you don't miss more important videos like this one. Thank you so much for watching.